Surrey is seen by many people to be very, very rich, very leafy, very suburban. Everyone who's made their money in London comes to live in Surrey and all is really well. There is an element of that, but I think what's really important to understand is that there are pockets of serious less advantage, and it's very difficult in some ways to be somebody of less advantage in a very wealthy area.
We have this health disparity in our community, and we have areas where we could be doing much more.
There are significant health inequalities which exist within the minoritized ethnic communities across Surrey.
I was actually very shocked that at our age, people with disabilities can pass away.
There are pockets and wards of areas where people live in situations where you can expect them to have 11 years less life expectancy.
The strategy for Surrey Heartlands is primarily focused on improving health outcomes for our residents. This is about having a joint strategy that will really focus on preventative activity. We'll look at how we can deliver those services more effectively and all aspects that help support that delivery.
If the NHS carries on working on our own, we can only improve people's health outcomes by 20%.
30% is really around public health and your own behaviours, so what you eat, drink, whether you exercise and so on. And then the other 50% are things, particularly the local government influence around broader socio-economic factors.
So it doesn't matter how good your diabetes pathway is or how good your cataract pathway is. If somebody is homeless, or if they're frightened, or if they have an addiction problem, you will never improve their overall health in the best way possible unless you address those underlying issues, which is why working as an integrated care system is so important for us, because we cannot help our population achieve their full potential unless we work together.
At the moment, about 30% of our population have one or more long-term conditions. So although we made a lot of progress in improving health or live longer, a lot of those extra years are spent in poor health. So prevention is key in everything we do.
We have issues with blood pressure, diabetes levels, and that therefore increases the risk of heart attacks and strokes if we don't address them sooner rather than later. And we've got these fantastic initiatives. For example, we have blood pressure at home, whereby patients can monitor their own blood pressure in their own environment, where they're more comfortable and more relaxed, and then upload their blood pressure readings onto an app, which then is then essentially looked at across each of our 4 places.
Since I've been on the home monitoring scheme for blood pressure, I think I've only been to the GP surgery once or twice the last 2.5 years, whereby before I used to be there regularly. It makes somebody feel very good to know that there is somebody looking at my readings at the same time I am doing it. And if there is something wrong, they do get in touch with you. That's all I can say.
Prevention also takes into consideration the wider determinants of health or the drivers of health inequalities, which include our built environment, employment, education, all of those things that we need to address to make sure our population live a healthy life.
And the heart of the issue is often they don't know who can help them. They don't know where to go to get that help. And perhaps as well for some, they're not even sure if anyone is going to be able to help them.
Growing health together is really an invitation to collaborate to try and create improved conditions for health and well-being for everyone. In Red Hill, it had been identified that the South Asian community were experiencing worst health inequalities.
The issues may be that because of the language barrier, because because of the cultural issues.
Myself and Dr. Aziz have started this group. It's the Asian Women's Wellness Hub. We have fortnightly sessions in which we encourage them to exercise. Dr. Aziz comes and speaks to them about different health issues.
We ask them, what do they think they need more? So they want to know a bit more about diabetes. They want to have more fun activities.
Basically encouraging women to get fitter, healthier, and focus on mental health as well.
And this group is self-organised with some support and is now tackling health outcomes and health inequalities.
And I suppose the ambition really is to keep care closer to home. No one wants to go into hospital if avoidable. Relatives want to keep their loved ones at home and the patient wants to stay at home as well. So how can we do that in the community? I suppose the best way to do that is really creating those integrated neighbourhood teams. We have some great examples where we have members of the multidisciplinary team coming together to really support the health and well-being for those individual cohorts.
I was admitted with what turned out to be heart failure, totally dehydrated, and also had a urinary infection.
He was brought to our attention by our front door team, where we identify people that are living with frailty, that are coming in some kind of crisis, and we then proactively get involved.
Suddenly my dad was in this place where not only did they get such thorough assessment of his physical health, emotional health, but also they got him, the human in him, and that was just incredible.
So access is another key area we need to focus on. And access really isn't just a case of providing more appointments, it's about making sure that the patient or the resident sees the right person first time round in the right location, be that your GP, your community pharmacist, an A&E doctor, minor injuries unit clinicians, or urgent treatment centres. Or if you're housebound, the urgent community response team.
I found the UCR really useful in making sure that my patients can be seen really quickly within a 2-hour time frame.
It's a one-stop shop. We come in, we look at all aspects of their life.
Without the care input as well as the medical side and the therapy side, a lot of patients wouldn't be able to remain at home and would end up in hospital.
And if they have a fall, we can tell them, look, we can give you equipment, we can come this afternoon and bring you some Zimmer frame. And they look at me like, what, seriously, can you do that? Like, yeah, of course we can.
The step-down service came about because Speltham Borough Council had identified that there was a need to support the hospital. They decided to look at an option where there was a temporary accommodation for people who were remaining in hospital for extended periods of time because their home or their destination was not suitable to be able to meet their current needs.
It was a lifeline, just as literally for him to go somewhere to get into your own home again.
I've been here 4 months. I'm more than happy to be here. I think this was ideal.
If we get this right, it will lead to better patient experience, better patient outcomes, much better care, but also be beneficial to the system as a whole.
I don't think we can possibly tackle health inequalities as professionals alone. We really need to be building relationships with, listening to, and most importantly, responding to what we're being told.
Only when somebody feels safe in sharing with you who they are and what their problems are will we access any form of support or help for them.
Local area coordination is a network. It's a new approach to supporting residents at a very hyper-local level. It might be that they're facing crisis, it might be that they have a strength and skill they want to share and get more connected with others.
I got diagnosed with depression and anxiety and got put on medication, and it's just sort of gone very much up and down, up and down.
Michelle was kind of feeling a bit lost in that she had this role of mum, but she was struggling to figure out what was beyond that.
I've always enjoyed doing arts and crafts and fiddling around, and it drives my partner crazy.
With local area coordination, I've got such good connections with different community assets and people that I kind of just linked Michelle to the church.
I would not have started my own group before I met Willow. I definitely would not have done. She's given me confidence.
The importance of our voluntary sector is absolutely crucial. I would love us as a local authority and the NHS as a statutory agency to acknowledge their work a bit more than we do, but also to see the variety that's there. It's not only the big players, there are lots of others that can, come forward and help us.
Communities have a significant role to play in terms of taking ownership and charge of their own health and well-being. And one way of doing that is that SMEF, in collaboration with Surrey Heartlands, can run a host of information seminars and workshops, make the people aware of the importance of living a healthier lifestyle.
In order to deliver gold standard care, we do need to think about our enablers, and I think one of the key enablers is digital transformation. And we're lucky in Surrey Heartlands, we've got lots of technology that we're using, such as our blood pressure at home devices. We've also got our Surrey Care Record, which connects all different parts of the system, whether you're a hospital, or whether you're a GP surgery, or whether you're a local hospice or community services. And that has benefits on multiple levels. One, it allows the clinicians to work more collaboratively together. Two, it allows a patient just to tell the story once rather than having to say the same thing on multiple different occasions. But more importantly, what it is doing is it's making sure we deliver high quality and safe care for our patients.
The system can be seen as rather fragmented between voluntary sector employers, health employers, social care employers. In practical terms, where this strategy will take us to is that there's less differentiation about where the worker comes from. They should be able to ultimately work in neighbourhood teams where they're sharing a room like this with people that they know really well. You might have 4 or 5 different employers represented in that room, but nobody will mention it, it won't be noticed. That there is fair commonality access to pay and reward, which enables that mobility. There is shared learning.
We've got some real opportunities working together to change the way we recruit, to create career pathways. I think we will have just much healthier, happier workforce and clients and residents in Surrey.
I think the opportunities going forward for us and what success looks like is that we have to continue empowering our communities to care about themselves and in a way have their L'Oreal moment, believe that they're worth it.
Success would look like the patient and citizen feeling that we're organising the system, health and social care, around them, rather than allowing them to bounce around a system in an uncoordinated and difficult way.
Success for me will look like my mum, who lives in Surrey, being able to know where to go and get care when she needs it, being able to access care easily and readily, and feeling confident that she will receive the right care when she needs it in a place that works for her.
Surrey Heartlands is a leading system, and I have every confidence that if we get this strategy right and we deliver this strategy, we will have delivered huge improvements for our residents in Surrey.